10 warning signs and symptoms of breast cancer. It could save your life. Did you know that 1 in 8 women in the United States will suffer from breast cancer at some point in their lives? In 2024 alone, the National Breast Cancer Foundation estimates that over 300,000 women and 2,800 men will be diagnosed with invasive breast cancer. So the burning question is, how can you avoid becoming part of this statistic? Well, the answer is early detection. You see, when breast cancer is discovered early, it's much easier to treat, and survival rates improve significantly. In this video, we'll share the top 10 warning signs and symptoms of breast cancer that you should never ignore. But before we dive in, let's define breast cancer and its risk factors. Breast cancer usually begins in the milk ducts or the milk-producing glands of the breast. As it develops, the cancer cells can spread into the surrounding breast tissue, forming a noticeable lump. If not treated, the cancer may advance further, spreading to the lymph nodes and other parts of the body, a process called metastasis. Many factors can increase the risk of breast cancer. Age is one of the biggest, with the risk rising sharply after age 50. Family history also matters. Having a close relative with breast cancer raises your chances. Hormonal factors, like starting your period early or going through menopause late, can also increase the risk. Lifestyle choices, such as drinking alcohol, smoking, being overweight, and not staying active, are other factors that can make breast cancer more likely. Additionally, exposure to radiation and certain genetic mutations, such as those in the BRCA1 and BRCA2 genes, can significantly elevate the risk. Unlike women, breast cancer is rare in men, making up less than 1% of cases in the U.S., with a lifetime risk of 1 in 726. It's most often diagnosed between ages 60 and 70, with an average age of 67. However, breast cancer is more deadly in men because they are less likely to suspect a lump as cancer and are often unaware of the condition, leading to delayed diagnosis and treatment. That's why it's super important for both men and women to pay attention to the warning signs before it's too late. Now let's dive right into 10 warning signs and symptoms of breast cancer that could save your life. Number 10, changes in breast size. Changes in breast size can be a subtle yet significant sign of breast cancer, often overlooked until it becomes more pronounced. Imagine waking up one morning and noticing that one of your breasts seems slightly larger than usual. You might think it's just a temporary change, perhaps due to hormonal fluctuations or even how you slept. But what if this change persists or becomes more noticeable over time? Breast cancer can cause changes in breast size due to the growth of a tumor within the breast tissue. Unlike normal cells, which grow and divide in a controlled manner, cancer cells multiply uncontrollably. This unregulated growth can lead to the formation of a mass or lump within the breast, which can alter its size and shape. If you notice any persistent changes in your breast size, it's important to consult a healthcare professional for a thorough evaluation. Number 9, changes to the skin's texture. Breast cancer occurs when abnormal cells in the breast tissue grow uncontrollably, forming a tumor. As the tumor grows, it can affect the surrounding tissue, changing the skin's texture. This can result in dimpling, puckering, or an orange peel appearance, with small indentations on the breast. This texture change happens because the growing tumor pulls on the surrounding tissue, creating an inward tugging effect. This tension pulls on the skin, causing it to dimple or pucker. Additionally, cancerous cells can spread to the lymphatic vessels in the breast, causing a buildup of lymph fluid. This can lead to swelling and inflammation, further affecting the skin's texture. Regular breast self-exams done carefully and with attention can help you notice any changes in your breast texture early on. Number 8, itching or irritation. Itching or irritation in the breast may seem like a minor issue, perhaps caused by a new fabric or temporary skin irritation. However, if the itching persists, it could be a sign of something more serious. Breast cancer can appear in unexpected ways, and itching or irritation can be one of its subtle yet important symptoms. This symptom can be a sign of inflammatory breast cancer or IBC, a rare but aggressive form of the disease. Unlike other types of breast cancer, IBC doesn't usually present with a distinct lump. Instead, it causes noticeable changes to the skin and tissue of the breast. This type of irritation can be due to cancer cells blocking lymph vessels in the skin. When these vessels are blocked, lymph fluid can't drain properly, causing the skin to become red, swollen, and itchy. Number 7. A marble-like hardened area under your skin. A marble-like hardened area under the skin can be a silent but concerning sign of breast cancer, often going unnoticed until it becomes more noticeable. This hardened area is usually a sign of a growing tumor within the breast tissue, which can cause changes in the breast texture and structure, leading to the development of hard, immovable lumps. These lumps are usually irregular in shape and can be felt as distinct masses under the skin. Unlike benign or harmless lumps, which are smooth and movable, cancerous lumps are typically firm and fixed in place. While normal cells grow and divide in a controlled way, cancer cells multiply uncontrollably, causing a mass or lump to form within the breast, changing its size and shape. Number 6. Breast or nipple pain. Unlike other discomforts that come and go, pain caused by breast cancer is steady and often localized. This pain occurs as a tumor grows and presses on the surrounding tissues and nerves. The pressure results in constant pain, which may also be accompanied by other symptoms like swelling or changes in the skin. The intensity of the pain can vary and may become more noticeable in certain positions or during specific activities. Some types of breast cancer, like inflammatory breast cancer or IBC, are more likely to cause pain. IBC is an aggressive form of cancer that makes the breast red, swollen, and warm, leading to significant discomfort. The pain occurs because cancer cells block lymphatic vessels, causing fluid buildup and inflammation in the breast tissue. Before we move on to the next important sign, we'd really appreciate your support. If you're finding this information helpful and want to stay updated on more health tips and awareness videos, please give this video a thumbs up and hit that subscribe button. Don't forget to click the notification bell so you never miss an important update. Number 5. Swelling in all or part of the breast. Swelling in all or part of the breast can raise many concerns, but it can also be a sign of breast cancer, even if no lump is felt. This happens because as breast cancer develops, it causes changes in the breast tissue, leading to swelling. One reason for this is the growth of cancer cells within the breast tissue. As cancer cells multiply, they can cause inflammation in the surrounding tissue, leading to swelling. This swelling can affect all or part of the breast, and a lump may or may not be present. In some cases, the swelling may also be accompanied by redness, warmth, or changes in the breast shape. Number 4. Nipple retraction. You might think nipple retraction is just a temporary change, maybe due to an injury or breastfeeding. But what if it's a sign of something more serious? Nipple retraction happens when the nipple turns inward, and it can be a concerning symptom of breast cancer. This is often linked to invasive ductal carcinoma, the most common type of breast cancer, which can cause the tumor to pull on the duct behind the nipple, leading to retraction. The mechanisms behind nipple retraction in breast cancer are linked to the growth of the tumor and its impact on surrounding tissues. As cancer cells multiply and invade the breast tissue, they can lead to inflammation and scarring, which pulls the nipple inward. This change may start off subtle but becomes more noticeable as the tumor grows. If you notice nipple retraction, it's important to take it seriously and seek medical evaluation. Number 3. Nipple or breast skin that is red, dry, flaking, or thickened. Imagine noticing that the skin on your breast or around your nipple has become unusually red, dry, and flaky. This could be a sign of breast cancer, often caused by cancer cells growing in the ducts or lobules of the breast. As these cells multiply, they can inflame the surrounding tissue, leading to skin changes. The skin may become red, dry, flaky, or even thickened and hardened. In some cases, skin changes may be accompanied by other symptoms like itching, burning, or tenderness. Another cause of skin changes in breast cancer is the blockage of lymphatic vessels. As cancer cells grow, they can block these vessels, which are responsible for draining fluid from the breast. This blockage can lead to fluid buildup, causing further skin changes. Number 2. Nipple discharge other than breast milk. Nipple discharge is any fluid that comes from the nipple, except for breast milk during lactation. This can be a sign of breast cancer when abnormal cells in the breast tissue grow uncontrollably, forming a tumor that disrupts the breast ductal system. As the tumor develops, it can cause the release of fluid, blood, or pus from the nipple, serving as a visible warning of a potential cancer. Nipple discharge can vary in characteristics, with colors ranging from clear to yellow, or even blood-tinged. It can also differ in consistency, appearing thin and watery or thick and sticky. In some cases, nipple discharge may be accompanied by other concerning signs like a lump, skin changes, or nipple retraction. To detect nipple discharge as a possible sign of breast cancer, it's important to be aware of your body's usual state and notice any changes. Number 1. Swollen lymph nodes under the arm or near the collarbone. Lymph nodes are small bean-shaped structures that act as guardians of the lymphatic system, filtering out harmful substances and supporting the immune system. However, when breast cancer cells spread from the primary tumor, they can invade nearby lymph nodes, causing swelling as the nodes work to fight the cancer. Swollen lymph nodes in the underarm or near the collarbone are especially concerning for those at risk of breast cancer because these areas are close to the breast tissue's lymphatic drainage. As cancer cells grow within the lymph nodes, they can block the normal flow of lymph fluid, leading to swelling and discomfort. Swollen lymph nodes may appear as small, tender lumps under the skin, often with a feeling of fullness or pressure. While not all swollen lymph nodes indicate breast cancer, if this symptom is accompanied by other signs mentioned in this video, it's more likely to be linked to breast cancer. Remember, we all have a good chance of surviving breast cancer. The key is staying aware and paying attention to your body so you can easily detect any symptoms mentioned in this video. Early detection can greatly improve outcomes and lead to more effective treatment options. Thanks for watching. We hope you found this information valuable and insightful. If you did, please don't forget to give this video a thumbs up, share it with others, and subscribe to our channel. Kindly hit the notification bell so you never miss an update on important health topics. Remember, the information provided in this video is for educational and informational purposes only. It is not intended to replace professional medical advice. Always consult with your physician or a qualified healthcare provider before making any significant changes to your diet, exercise routine, or healthcare plan. Your health is important, and having professional guidance can make all the difference in ensuring the best outcomes. See you in the next video.